Good morning, everyone. My name is Leah, and our master's project is examining PBL curriculum concurrent with fieldwork experience. I've been working alongside Karla, Ale, and Nada under Dr. Brown for the past 2 years, and we are excited to share with you our research.
Okay, so what is PBL? PBL stands for Problem-Based Learning, and it is a student-centered, self-directed educational pedagogy. Some of the main characteristics include small groups that are self-directed and usually guided under a faculty member after they're given a real-world problem. It incorporates active learning, and students are in control of their learning. A diagnosis and creating a treatment plan are usually part of solving the problem that was given. And also teamwork, critical thinking, reflection, and the use of outside resources to fill any knowledge gaps are pillars of PBL. So what are some primary issues that we saw? There was a gap in transferring educational knowledge to clinical setting, and a lot of students were finding it difficult to conceptualize didactic courses and how those would transition into their clinical experiences once they graduated. Students also are placed in different fieldwork settings, meaning that they get different fieldwork experiences and that they engaged in different aspects of occupational therapy, which eventually led to a discrepancy in knowledge gained. After we conducted our literature review, we saw that the intersection between PBL, fieldwork, and occupational therapy was rare, and once we narrowed that down to pediatric fieldwork, that was non-existent. So this research utilizes a single case study and a PBL framework to focus on different scenarios students may encounter in the field to close the knowledge gap that we found. It is also important to note that our research, specifically our PBL framework, can be used in other fieldwork settings such as phys-dis or psychosocial, as well as other disciplines.
We conducted our literature review to investigate the different modalities in which problem-based learning could be implemented and what the previous research has found from its benefits. So we have gathered that PBLs can be taught online or in person and can incorporate simulations, role play, or case studies. PBLs can be implemented in a range of healthcare and medical settings, and overall, the findings from the research suggests that PBLs improve overall academic performance in students compared to lecture-based learning. Specifically, PBLs improve individual skills such as problem-solving ability, self-efficacy, reasoning, communication skills, team efficacy, and critical thinking. Overall, there are a variety of modalities in which PBL can be used, but regardless of how it's implemented in the curriculum, research demonstrates that it has an overall positive effects on students.
So using all the research that we did, we came up with our research question, which was, how can the PBL framework be utilized within Downstate's OT curriculum to support students' learning, increase student confidence, and provide a foundational level of knowledge to better prepare students for their pediatric fieldwork education? As Karla and Leah mentioned earlier, we felt that this was important to be addressed because of the major gap between the student didactic education and their student readiness to go into a clinical setting. So going into materials and methods, bear with us a little bit because it is a lot. I would also like to preface just by saying that the 3 surveys that we did conduct throughout this project were sent to students through their Downstate emails. They were all consistent of mixed methods research design, and the data was collected through Qualtrics. So in preparation for creating this PBL module, we developed an initial survey, which was the first survey we did, and that was sent out to the 3rd-year occupational therapy students who had just completed their level 1 pediatric fieldwork rotation. So for this survey, we used it to gather more information on their fieldwork experience before, during, and after their rotation. This was made up of 3 sections that discussed their previous experiences with the pediatric population, their thoughts on the current Downstate curriculum and how that benefited them in their experience. And the 3rd section consisted of external variables at their specific fieldwork site that impacted their experience. So out of the 32 students in that cohort that received the survey, we got 15 responses. So after conducting that survey, we participated in a structured interview and observation with an occupational therapist who works very closely with Dr. Brown. And we observed her with her 3-year-old client and his mother. And this was all to gather more information to create a case study, which will be implemented in our PBL, which we will discuss shortly. We used the information from the 3rd-year survey and the observation to help develop the PBL curriculum, and that was implemented with our lovely 2nd-year cohort. And to gather the data of on the effectiveness of the PBL, we created a pre- and post-survey, once again used with the 2nd-year cohort. In terms of that survey, in terms of those 2 surveys that we did, we had a total of 28 participants. And the questions in those surveys mainly focused on their prior knowledge, once again, in pediatrics, and their confidence levels in terms of managing several complex variables such as intervention planning, just being able to apply their occupational therapy didactic knowledge, adapting activities, and communicating with caregivers.
So to give Nada a little break from talking about the materials, because that was a lot, we wanted to highlight the curriculum that we developed because we did put a lot of time and effort into that. So we developed a PBL curriculum that consisted of past medical history, case studies, mother's concerns, as well as additional resources to students to adequately help them through the process of working within their groups. The PBL curriculum itself was given over the course of 4 classes, 4 fieldwork seminar classes in 1.5-hour sessions. One was held via Zoom. The documents also consisted of, it's not on this, but we also developed previous evaluations that were given to us by the occupational therapist and kind of cut and paste what was needed in order for the students to develop an accurate understanding and appropriate intervention planning for this child. Out of our cohort, we strategically designed 8 groups, and I say strategically because research had previously shown that taking the strengths of each individual student and putting them in a group actively helped the cohesive process of working through that group, and so we kind of use that strength-based approach on just how we know our classmates and putting them together in terms of personalities and what we see as their strengths.
So to break down what we did in each of the 4 PBL sessions, students participated in a range of activities. Groups created an occupational profile, identified primary concerns, as well as selected an assessment that they would administer to garner more information about our case study client, as well as created attainable short-term and long-term goals. Each group had to provide their clinical reasoning to explain their decision-making. We also had a parent interaction experience where Dr. Brown role-played as the client's parent, and she expressed different concerns and varying emotions and demeanor, and each group had to respond accordingly. We also presented roadblocks where each group had to adjust their treatment plan that they created, thinking on their feet to create a new treatment plan. And we really wanted to emphasize realistic clinical experiences where groups had to think on their feet, because these scenarios will happen when we enter the field, and we wanted to prepare students to navigate these challenges that they will face in clinical practice. In the last session, groups who had the same roadblock were paired, and each presented their initial treatment plan, their treatment plan that they had adjusted, They presented the clinical reasoning behind their decisions, and it was followed with a class discussion.
Okay, so out of all the surveys that we administered, what did we actually get from them? The third year survey, as you can see here, we created a nice little table. The boxes in gray are the ones that support the implementation and creation of our PBL, so yay to those gray boxes. 66% of third years said that there was an overall dissatisfaction in the Downstate curriculum in some shape or form because of the lack of preparedness for their pediatric rotation. There is a lack of confidence in their ability to create and modify intervention plans, as well as other things such as grading activities and communicating with family members. 74 to 86% actually believe that some form of a simulation, a curated case study, or a PBL would have been useful. So for our second years, we did give them a pre-survey that was mostly just to get baseline to compare the post-survey to. And here you'll find some wonderful numbers. As you can see, almost all of them are above 75%. Yay. I would like to point out I feel better prepared to adapt my intervention plan when faced with unexpected challenges. A whopping 93% agreed. Yay. And if you can see here in this graph, the light orange is for the pre-survey, the dark orange is the post-survey, and of all the things we surveyed, everyone had an improvement.
So just to talk about our main objective, we wanted to implement this PBL to determine the effects of student readiness, student confidence, and overall foundational knowledge that was found amongst students. We surveyed in the survey of third-year students, we found that there was an evident dissatisfaction in the Downstate curriculum, specifically when in preparation for pediatric fieldwork. They found it difficult because the pediatric rotation specifically they had no preparation prior to entering the rotation, as for other rotations such as psychosocial and phys-dis, they had that adequate preparation, whether that was a few weeks or even a month up to prior to starting fieldwork. So they found this to be difficult when entering the clinical setting. They also found that the fieldwork seminar class was not helpful, and it did not provide any resources or additional extensive help to kind of help them through that process of going through the fieldwork process. Okay, the next slide. Thank you. And then for our second years, we found an overall increase in knowledge and confidence, so we were very happy about that. We also saw roughly a 30% increase in students that agreed that PBL improves their understanding in pediatric-specific topics. And we wanted to highlight this research piece that we found in our literature review, stating that students with a PBL background displayed positive attributes and that those with PBL experience were able to implement their education to different scenarios, which is an important skill to apply to clinical settings. And so we found this prior to implementing the research. We wanted to emphasize that this is what we saw in our cohort. We saw the positive attributes, we saw the improved confidence, and we hope that you guys are able to bring that into your confidence levels when going into fieldwork too. Next, how do I do this? Oh, thank you. So our limitations consisted of a lack of third-year responses, as Nada has stated. There was only 15 out of 32 students that replied. So this created an insufficient sample size and a sample bias, which basically means, in layman's terms, that we cannot generalize that this is how all of the third-year students felt. But we did still take their information, obviously, into consideration. So our next limitation was that there was a lack of generalizability to every OT program, as OT programs vary based on curriculum. They also vary depending on whether you're getting an MSOT or a DOT, so this can't directly be transferred to it, but rather used as a template if it's for a doctorate. It also, as I previously stated, only reflects pediatric level fieldwork for the Downstate curriculum. Because of that specific piece, an important piece of that, in phys-dis and in psychosocial, there was that preparation time. Pediatrics didn't have that, so this was very specific to this. And Last but not least, there was only a single case study that was given. And though we tried to involve a medically complex diagnosis, there was only so much that we can provide. And so the generalizability to other diagnoses is still lack thereof. Our future directions, we hope that Downstate continues to implement this within the pediatric fieldwork course with a little tweaking because it was our first time. So they still continue to implement this. We also hope that not only the pediatric rotation, but as the physical disabilities and the psychosocial also implements it, though students did feel more prepared because of that previous amount of time, I don't think it'll hurt for students to feel more confident when going into their fieldwork.
Okay, we just threw a lot at you. What did we actually just say? So we started with a question. How can a PBL framework be utilized within Downstate OT curriculum to support student learning, increase student confidence, and provide a foundational level of knowledge to better prepare students in their pediatric fieldwork education? After our literature review, we surveyed third years, which just showed us that there was a lack of preparedness for their pediatric fieldwork 1 rotation. We then created and implemented our PBL prior to this rotation with our beautiful second years. And then we surveyed the second years and found that PBL improved student readiness. Yay! Here are some of our references.
And this is our mascot, Pebbles. If you know, you know. Yabba dabba doo. Thank you.
Yeah, so you just, I mean, as having experienced the module, I did think that it was very satisfactory, and I thank you for doing that work. For future implementation, you mentioned that you would want to do like a future like tweakings on your module. What are some suggestions that you can give even to some of our first years that are here and might be continuing your project?
So we found part of our post survey consisted of subjective questions that weren't necessarily within the statistics because it was just of how to improve. So we found that more involvement from Dr. Brown with the students themselves, because we did facilitate a lot, would be beneficial. So more professor interaction. Also, we had implemented roles to each group, so we would just take those out because I think the strength-based approach of just creating the groups based off of personalities really helped facilitate the cohesion of the group. Anything else?
Yeah, we also had to do like a crash course, so this happened within like 3 weeks of starting, and we understand that that was very, very fast. Ideally, it would be spread out through the course of a semester, so that would be some feedback. Any other questions?
Thank you. That was excellent. And I'm happy you had the experience of building a curriculum to benefit the students and enhance our curriculum. It's certainly part of the continuous improvement process that we have here. Perhaps you can share a little bit more about your survey development and how you made sure the questions that you were asking were had the right sensitivity and specificity in terms of getting the answers or asking the question in the right way to really understand the problem.
So here are some questions, word for word. But we did go into this wanting to first get any like bias out of the way. So we asked first what their previous experience with pediatrics was, because that can influence their preparedness for fieldwork in pediatrics. We were then working really closely with Dr. Brown to kind of like tweak all of our questions to make sure they weren't leading questions. And a lot of them were a Likert scale. The last 3 were sort of repeating, but they were qualitative, so people could tell us in their own words what they would change, or if they wouldn't change anything, what that would be. So I feel like that's how we mostly went about it.
I feel like, I'm sorry. I feel like we also really tried to understand the clinical experience itself and understanding that every CI is different, and the support that each site can provide to an individual and a student varies. And so that can also affect how they feel prepared going into the site itself, whether that is like burnout that the CI is going through, their caseload, all the other different variables. So we also asked questions in terms of that, like how much support that they received from their fieldwork supervisor to eliminate is that the problem? Because if that's the problem, then, there's something else going on here in terms of just institutional and clinical burnout. And I think that's how we were able to kind of objectively remove the subjectivity. And that's it.